I appreciate your presence today, particularly since I almost didn't make it. The mail came this afternoon, and in the mail was a credit card bill. And when I looked at the number, it was quite staggering. And this is something that's happened in my house for the last several months. So I showed the bill to my wife, and we had a huge fight. And we separate and go to opposite ends of the house, and I have a couple hours while I'm preparing for this, and what I did is I made a graph. So I pulled out all the credit card bills, and you can see on the slide that I've listed my wife's credit card spending over the course of the last year. And on the x-axis are the months of the year, and on the y-axis are dollars in $5,000 increments. And the spending in the first half of the year is fine, but in the second half of the year, the spending goes up exponentially month after month. And I say to my wife, this is not sustainable, we can't do this. And so I had a little bit more time, and I made another slide for you. And in this one, I take the percentage of Diane's credit card spending each month over our total income. And on the x-axis are the months of the year, and the y-axis is the percentage of our total income. And you can see that the expenses go up month after month after month, reaching a maximum of almost 25% of our total income. And I say to my wife, this is not sustainable. And so I'm looking at these graphs, and they look familiar to me. And so I'll show you again Diane's credit card expenses, and the graph is identical to the federal health care expenses graphed since the onset of the Medicare program in 1965. And in this graph, on the x-axis are years, and in the y-axis are billions of dollars. And you can see that as the program begins, the spending is reasonable, but in the last 20 years, the spending increases exponentially. And I made one more graph, and then we look back to Diane's percentage of our total income spent on her credit cards is really the same graph as the amount of federal expenses paid to the Medicare and the Medicaid programs. And again, I would say to you, this is not sustainable. Not sustainable in my house, not sustainable in the house of medicine. So we must be doing something differently in the United States. So I'll show you a graph of the healthcare expenditures per capita compared to several other countries. And in this slide you can see the United States in red, multiple other developed countries in other colors clustered together. Now granted, these countries have different payment systems, some a single payer, some private payer systems, but the United States clearly differs from the way other people spend money on healthcare. What does that mean? Well, perhaps it means that we have better outcomes. We spend more, so we do better. Well, in fact, we don't. And I share with you in this slide a graph of healthcare expenditures per capita compared to average life expectancy as a general measure of quality of healthcare around the world. And you can see that there's a linear trend for expenses compared to life expectancy, with one exception, and that's the United States. And we are an outlier. And what does this mean? This means that something has to change, that this system is unsustainable, and change is a difficult word. When we hear the word change, it makes us feel uncomfortable. It makes us feel like something bad is going to happen. And so there are many examples of change that I could give you. And the first one I would do is, if we think back to when we were kids, those of us that are my age, we used to go out on Saturday mornings, and we'd come back on Saturday night when the sun set to eat dinner. And now, if our kids went out to play, would we let them do that? And I think the answer for most people is no. And that's because something has changed. Now, is that a good change, or is that a bad change? And I would argue that as long as the change is in the right direction, nobody's going to object. And actually, Winston Churchill said that. But really, there are three perceptions that we can have of change. Either it's bad change, it's good change, or I'm not sure change. And let me give you a couple of examples. The first one that I would pick would be climate change. Now I'd ask you, is that a bad change, a good change, or I'm not sure? I think most people, when they hear the word climate change, would say that's a bad change. But there certainly are a substantial number of people that would view that as not being sure whether that's a bad or a good change. Let me give you another example. Suppose there was an invention, a device that would replace your date book, replace your record player, replace your telephone, replace all of those things and put them into one device that you could wear on your hip. Is that a good change or a bad change? Now, I think most people would argue that that's a good change, but there certainly are a few people that like to carry their calendar with them on paper, and they might think that that's a bad change. One more example of how we might perceive change. Suppose that device had a new model that came out, and they were going to replace the small headphone jack with a different jack, so that the headphones that you bought to listen to your music that you enjoyed would no longer work with that device. Is that something that's good, bad, or you're not sure? And I think most of us would say at this point, we're probably not sure. And I would suggest to you that the perception of change that you have correlates heavily with your reaction to change. And so today's change for the medical society is a change in leadership and a change in president. And I'm not going to poll the audience and ask you if you think that's a good change or a bad change, but I will tell you there are people that view it differently. For example, Steve's wife, the outgoing president, thinks this is a good change. And my wife, the incoming president, thinks this is a bad change. And so again, I just use that as another example to illustrate how we perceive change, because if you don't like something, you need to change it. And if you can't change it, you need to change your attitude. And that's a quote from Maya Angelou. So, as I gave you 3 perceptions of change, I'm going to give you 3 responses to change. When something comes upon you that's new and different, you can either fight it, you can accept it, or you can lead it. And I would argue to you that we need to find the right balance between those 3 things. So I'd like to give you one more example. Suppose your property tax bill comes in the mail instead of your credit card bill. You look at the bill and the assessed value of your house goes up, therefore your property taxes go up. What do you do with that? Well, I think a lot of people would say, this is not good, but they'd sit down and eventually write a check. Some people react differently. They take that bill and they follow the appeal process and they try to reduce their property taxes. So they fight it. But how many people would lead change? How many people would see that bill come time and time again and decide that they want to run for property tax appraiser for their municipality and lead that change? And so leading change really is advocacy. And we all advocate in our lives for our family and our friends. We advocate for our children in school. We advocate for our relatives when they're in the hospital and they're sick. But we need to make sure that we advocate for our profession. We need to advocate for health care. We need to advocate for our patients. And I believe that the seeds of advocacy are in all of us. And I will tell you that the seeds for advocacy were placed in me 30 years ago. So I share with you another slide. And if you look at this slide, these are the results of the student body election for the Student Council at the University of Florida in 1982. And listed are all the names, and my name, Jim Goldenberg, is in the middle. Next to the name in parentheses is the party affiliation of each of the people running. And next to that is their vote total. And you can see that the people that got an asterisk next to their name had the highest vote total and won the election. And you can also see that they're all from the same party. Now, my vote total was reasonable, but I didn't get elected to the Student Council that year. But what I did do when I thought about it for a day or two is I wrote a beautiful letter to the student government newspaper. And I said, it doesn't matter what you think. It doesn't matter what your vision is. It doesn't matter who you vote for, because the student body elections at the University of Florida are controlled by the Greek system. The fraternities and the sororities pick their candidates. They vote in blocks. Those people get elected. Next election, stay home. I thought it was beautiful and I thought it was eloquent. 2 weeks later, an article in the student newspaper by my roommate, the name above mine on that list, and his letter was better than mine. And what he said is, if you have something that you want to change, and it's analogous to a cart being carried by several horses down the road, you darn well better hook up your horse to the cart and start pulling. And what'll happen is, the cart won't go to the direction that you want it to go right away, but it'll start to move in that direction slowly. And he made a very clear distinction in that letter between the horses and the asses. And the horses are the people that hook up their horse to the cart and start pulling, and the asses are the people that sit on a donkey on the side and watch. And I'll tell you, that seed was placed 30 years ago, and it laid dormant until several decades later, when I'm sitting at my desk, and a letter comes across inviting me to an advocacy forum. And I had some time, and my kids are a little bit older, and the demands on my time were a little bit less, and I filled it out. And I went to this place where I learned about advocacy. And not only did I learn about advocacy, but I met the people that were advocating for me. A smart, thoughtful, energetic group of people. I learned some new skills because advocacy is not taught in medical school. It's not taught in business. And when I learned those skills, I actually left my desk and went to Capitol Hill and had the pleasure of meeting several sitting U.S. senators and advocating for the House of Medicine. And so anytime we change, we need to manage that change. And change management is actually a science. It's something that people spend years learning. People do doctorates on this. They take classes. They get certified. And I share with you a slide that puts up the simplest concept of change management. And that is, the first thing that we have to do is unfreeze. We have a core set of beliefs, and we need to unfreeze those beliefs. And in the House of Medicine, the status quo is not acceptable. We then enter a period of transition, and I'm hopeful that this talk will begin that transition as we look for new ways to do things. And then when we're satisfied that we've transitioned to a better place, we can refreeze our beliefs and move on. And so I share with you another slide, and this is a picture that I took in Scottsdale, Arizona. I'm hiking with my wife and my stepdaughter. We're climbing up a red mountain. It's beautiful. The horizon is orange and yellow. There are green cacti popping out as we walk up the mountain, and we come upon this sign. And the sign says, strenuous beyond this point, and we look at each other and we say, what do we do? And the answer is, we go on. Unless you have a heart condition, then it's great that they put this sign here. And I share this with you because this is the strenuous part of this talk. Because I'm now going to ask you to do 4 things for me. And the first thing that I'm going to ask you to do is to unfreeze. And the reason that I ask you to unfreeze is because this graph, whether it's in my house, or your house, or the House of Representatives, is absolutely unsustainable. And something has to change. And the second thing I'm going to ask you to do is to use our resources wisely. We're advocates at the end of a busy day. We need to think about when we need to fight change, when we need to accept it, and when we need to lead it. And as I mentioned previously, I'm not sure that we're balanced. And so I offer you this prayer. Grant us the serenity to accept the things that we cannot change, the courage to change the things that we can, and the wisdom to know the difference. The third thing I'm going to ask you to do is to advocate and choose to lead change. Because if we stay in the present and we look to the past, we will not succeed. And I share with you another quote, which is, change is the law of life, and those who look only to the past and present are certain to miss the future. And that's a quote by John F. Kennedy. And the last thing I'm going to ask you to do is to become part of a team. Advocacy is easier when we work together. And the team for change that we have today with the Medical Society is a team that includes hospitals and physicians and the people that pay for medical care, and our patients, and those that support us with information technology and insurance and other healthcare services. And so I wanted to share with you the medical society team and recognize the physicians and the allied healthcare providers that work so hard to take care of patients. I want to recognize the nurses that spend all day with the patient while the doctor comes in and out for a few minutes and takes care of them and talks to their families. I want to recognize the hospital representatives who create the system for the sickest of the sick and allow us to do our job. I want to recognize organized medicine in the form of our state medical society and the national societies that help us. And I certainly want to recognize the leadership of the medical society, both in terms of staff and physician leadership, past and present, because anything we accomplish, we do because we stand on your shoulders. And lastly, I'd like to introduce you to my team. I have 4 people that I consider mentors: Paco Arasque, Alan Pillersdorf, Jack Zeltzer, and Larry Bush, people who I've watched change and advocate and bring together a team. I would like to recognize my partners in medical specialists and my partners in neurology, a thoughtful, compassionate, intelligent group of doctors I'm privileged to work with, the staff in my office and other physician offices that allow us to do our job well, my family, my friends, and particularly my children, who have taught me many things: how to be proud of themselves and how to be brave in the face of adversity, and certainly have taught me that I'm not as smart as I think I am. And I'd like to end this talk exactly where I started, by thanking my wife, who has taught me a new language, a language of love and compassion and success. If I have any tools, you have sharpened them. If I have any skills, you have honed them. And I appreciate you. And you've worked hard for your whole life, Diane. And you can spend as much on your credit card as you like. Thank you very much.